Did you know that 1 in 3 people will face cancer at some point in their lives? It's a terrifying statistic, but here's what most people overlook. Millions of cancer cases are diagnosed too late simply because early warning signs were ignored. According to the American Cancer Society, detecting cancer in stage 1 can increase survival rates to over 90% for many common cancers. But if you wait until stage 4, your chances of survival drop below 20%. The good news? Your body often gives you signals long before things turn serious. You just need to know what to look for. In this video, we'll reveal 8 subtle yet crucial warning signs that could save your life. Don't skip this video because the 7th warning sign will truly shock you. These aren't the typical symptoms you hear about all the time. Most people dismiss them as minor issues, but recognizing these signs early could mean the difference between life and death. Now, I know what you might be thinking. Does every little ache and pain mean cancer? If you've ever searched online, you've probably felt overwhelmed with misleading and fear-inducing information. That's why this video is different. We're only covering symptoms backed by science and medical research. These are the very warning signs that have helped thousands detect cancer early, when treatment is most effective. So stick around because this isn't about spreading fear. It's about equipping you with life-saving knowledge. Let's get started. 1. Persistent bone pain. It's more than just soreness. One of the most overlooked warning signs of cancer is persistent bone pain. Unlike soreness from exercise or minor injuries, cancer-related bone pain doesn't go away. It worsens over time and intensifies at night. This type of pain is commonly associated with osteosarcoma, a bone cancer that often affects the arms and legs. At first, it may feel like a mild ache or a muscle strain, but it gradually becomes more severe and unrelenting. Key symptoms of bone cancer: deep throbbing pain that worsens at night, swelling, tenderness, or stiffness in the affected area, and frequent fractures with little to no trauma. If you experience any of these symptoms, consult a doctor immediately. Early diagnosis is crucial for effective treatment. 2. Unexplained skin rashes. Could your blood be trying to tell you something? Certain skin changes can be early indicators of blood cancers like leukemia. Many people mistake them for minor irritations, but the key difference is how these rashes look and behave. A common sign of leukemia is the appearance of petechiae, tiny, round, red or purple spots that don't fade when pressed. These are caused by a deficiency in platelets, the blood cells responsible for preventing bleeding. Signs to watch for: small red or purple spots, especially on the ankles, legs, or under tight clothing, unexplained bruising that doesn't heal normally, and bleeding gums or frequent nosebleeds. If you notice these symptoms, seek medical attention. Early intervention can make all the difference. 3. Soaking night sweats. More than just a warm room. Waking up drenched in sweat could mean more than just a hot bedroom or stress. Persistent night sweats that soak through your bedding could be an early warning sign of lymphoma, a type of cancer that affects the lymphatic system. These aren't mild night sweats. They are intense, drenching episodes that often accompany other symptoms like unexplained fever and weight loss. When to be concerned? Night sweats happen frequently and aren't linked to stress or menopause. You experience fever, chills, or sudden weight loss, and your body feels constantly fatigued or weak. If you have persistent, unexplained night sweats, don't ignore them. Get checked by a doctor. 4. Jaundice. The yellow flag you should never overlook. If your skin or eyes suddenly turn yellow, this could indicate a serious problem with your liver or pancreas. One major cause is pancreatic cancer, which can block the bile ducts, leading to a buildup of bilirubin in the bloodstream. Signs that warrant immediate attention: yellowing of the skin and eyes, dark urine and pale-colored stools, unexplained upper abdominal pain or weight loss. Jaundice should never be ignored. Seek medical attention immediately. 5. Strange nail marks, a silent sign of skin cancer. Did you know that your fingernails can reveal signs of subungual melanoma, a rare but dangerous form of skin cancer that develops under the nails? This type of cancer often begins as a dark vertical streak on the nail, which many people mistake for a bruise. Signs of subungual melanoma: a dark streak under the nail that doesn't grow out, a widening stripe with uneven edges, nail splitting, bleeding, or discoloration. If you notice any of these signs, consult a doctor as soon as possible. Early detection is key. Persistent fevers. Could your immune system be warning you? A recurring, unexplained fever could be a red flag for blood cancers like leukemia and lymphoma. Unlike fevers from infections, cancer-related fevers tend to come and go without any clear cause. Red flags of cancer-related fevers: a fever that lasts more than 2 weeks, no obvious signs of infection, and fevers that follow a cyclic pattern. If you've had a fever for weeks without a clear reason, get tested immediately. 7. Sudden vision changes. Your eyes might be trying to tell you something. Did you know that eye cancer exists? Ocular melanoma is the most common type of eye cancer, yet it often goes undetected until it reaches advanced stages. Signs of eye cancer: blurred vision that doesn't improve with new glasses, flashes of light or dark spots on the iris, a growing lump or discoloration in the eye. Regular eye exams are essential for early detection, especially if you have light-colored eyes or a family history of eye cancer. 8. Chronic heartburn, more than just acid reflux. Many people experience occasional heartburn, especially after eating spicy, fatty, or acidic foods. But what happens when heartburn becomes a constant problem, refusing to go away despite lifestyle changes and medications? This persistent discomfort might be more than just acid reflux. It could be a warning sign of esophageal cancer. Esophageal cancer is a serious and often aggressive disease that develops in the lining of the esophagus, the tube that connects your throat to your stomach. One of its earliest symptoms is chronic acid reflux, also known as gastroesophageal reflux disease, GERD. When stomach acid repeatedly flows back into the esophagus, it irritates and inflames the lining, increasing the risk of cellular damage and mutations that can lead to cancer. But here's the alarming part. Many people ignore their acid reflux for years, assuming it's just a minor inconvenience. However, when acid reflux becomes chronic, it can lead to a condition called Barrett's esophagus, a precancerous state where the esophageal lining begins to change, resembling the lining of the intestines. This transformation significantly increases the risk of developing esophageal cancer over time. What are the red flags? Persistent heartburn is only one part of the puzzle. Other warning signs should not be ignored, as they may indicate that acid reflux has caused serious damage. Heartburn that lasts for more than 3 weeks. If you constantly experience burning pain in your chest, despite avoiding trigger foods and taking over-the-counter medications, it's time to seek medical advice. Difficulty swallowing, dysphagia. If food feels like it's getting stuck in your throat or takes longer to move down, this could indicate a narrowing of the esophagus due to scarring from acid exposure or, in some cases, tumor growth. Chronic coughing or hoarseness. Stomach acid can reach the throat and vocal cords, causing persistent irritation, coughing, or voice changes. Unexplained weight loss. Losing weight without trying can be a sign that your body is struggling with an underlying condition, such as esophageal cancer, especially if eating becomes painful or difficult. Blood and vomit or stool. Internal bleeding from esophageal damage can lead to vomiting blood or having black, tarry stools, both of which require immediate medical attention. Why early detection is critical. Esophageal cancer is known for being difficult to treat in later stages because its symptoms are often mistaken for common digestive issues. By the time many people seek medical help, the cancer has already progressed significantly. However, early detection can make a life-saving difference. Doctors can diagnose precancerous or cancerous changes in the esophagus through procedures like an endoscopy, where a small camera is used to examine the esophageal lining. If caught early, esophageal cancer can be treated more effectively, significantly improving survival rates. How to reduce your risk. While some factors like genetics can influence esophageal cancer risk, lifestyle choices play a major role in prevention. Here are some steps you can take to protect yourself. Maintain a healthy weight. Excess weight, particularly around the abdomen, increases pressure on the stomach, making acid reflux more likely. Avoid trigger foods. Reduce consumption of spicy foods, alcohol, caffeine, and acidic foods, which can worsen acid reflux. Quit smoking and limit alcohol. Both smoking and heavy alcohol consumption are major risk factors for esophageal cancer. Sleep with your head elevated. Raising the head of your bed by a few inches can help prevent stomach acid from flowing back into your esophagus while you sleep. Eat smaller, more frequent meals. Overeating can put extra pressure on the stomach and increase acid reflux episodes. When to see a doctor. Ignoring chronic heartburn can have serious consequences. If you experience persistent reflux symptoms despite lifestyle changes and medications, it's time to seek medical attention. Early intervention could prevent serious complications and potentially save your life. If standard treatments don't work, consult a doctor to rule out serious conditions. Don't wait until it's too late. Stay informed, stay safe. While chronic heartburn doesn't always mean cancer, it should never be ignored. Recognizing symptoms early can mean the difference between a treatable condition and a life-threatening disease. Be proactive about your health. If you or someone you know struggles with persistent acid reflux, encourage them to see a doctor. If you found this video helpful, give it a thumbs up and share it with others who could benefit. Don't forget to subscribe for more essential health content.